But if something changes the curve in your spine, let's say an injury, you were carrying bags of mulch or you were bending over to pick up something off the floor or tie your shoes or whatever it might be, if something causes an injury to your spine that changes the curve of your spine, then it's changed the alignment of how the vertebrae sit on each other. In response to that, muscles are going to get very tight. So what will typically happen when you injure your spine or when you're having a neck or a back issue or a spine problem, those muscles in that area will start to get tight. Now, they can get tight and they can stay that way for a period of time. It can come and go. It can come on, be there for 24 hours and go away and not come back for a couple of months. But generally it will start to present itself as an ache, a soreness, a pain, a stiffness, a tightness in a particular area. And it's usually localized to one spot. Now, as that problem progresses and the muscle continues to be tight and it changes the alignment of the vertebrae and starts to shift things a little bit, you'll still be looking like you're standing up straight, but that shift in position eventually starts to put abnormal stress and pressure onto the disc and or pressure onto the nerve. So what you'll start to get is, instead of the pain being localized to a specific area, it starts to become a lot more broad at that point. If you get some pressure onto a nerve, you can actually start to get some symptoms down into your leg or down into your arm that are following the line that that nerve travels out. But basically what needs to happen in that case is that we need to make sure that the alignment of the spine is back to the way that it should. That these vertebrae that have begun to pull further apart and shift their position, that we put them back into the proper position, we get that curve back into the curve that it should be in, so that number one, the muscle that was irritated and guarded and reflexively or protectively protecting things starts to relax. Number two, all of the muscles around that area start to get a chance to calm down and heal and do their job to hold things in place. And then number three, that whatever was beginning to happen with that disc and that nerve that was potentially going to cause that pain to spread and move into other areas, that problem is taken care of long before it has a chance to get going. It's that realignment and readjustment of the curve that allows things to fully heal and get your problem taken care of once and for all. And again, that can only happen under the treatment of a manual physical therapist. The manual physical therapist is going to be able to make sure that we bring that spine back into alignment, get the curve back into that spine, get the pressure off of that nerve so that everything gets a chance to heal, and now make sure that that problem is taken care of. So if you're having any problems, whether it's problems with mobility, problems with doing things during the day like bending over to tie your shoes, to reach up into a cabinet, to turn your head, etc. And again, it can be simple things like stiffness, ache, pain, or soreness, or it could be much more complicated problems like sharp pain, burning, numbness, tingling, etc. Any of those are because some portion of your spine is not in its proper curve, its proper alignment, and the muscles that are alongside of it aren't doing what they're supposed to do. And that's where the expert physical therapists at Loudon Sports Therapy Center come in. Give us a call, let's get you in here, let's get it taken care of, let's get your spine back into its optimal position and get you feeling healthy, feeling happy, being pain-free, and being able to do the things you want to do during the day.